So we had somebody come in with a question about, I'm going to try not to tongue tie this, osteopathic manipulative medicine,
Better you
and
than
an
me.
and an E&M. And or if you look it up in the CPT manual, you're going to look under osteopathic manipulative treatment. So it's a little, meaning the same thing, but people use different terms. And as we see that a lot in looking at in learning this, people know a lot of different terms for things that we don't. So when is it medically necessary to bill for the E&M code when a patient's being treated for, they're saying their example, here's low back pain, and the decision is to perform this osteopathic manipulative treatment on them? And should they use a 25 modifier? So first, some of you are probably wondering, what is osteopathic manipulative medicine? So that medical providers are going to do a manual therapeutic application of pressure, or they say force, into a body area. It's not chiropractic. A lot of people think that that's chiropractic. Chiropractors use specific modalities, specific procedures, just like occupational therapists and physical therapists use. So it's similar, but this you're looking at typically a DO, a doctor, an osteopathic doctor is going to do these kinds of treatments typically. There are other people qualified to do this as well. So it's also called, osteopathic manipulative treatment. So it's treatment used on the structural and functional issues that somebody's having with bones, joints, muscles, tendons, tissues. So a specific area in the body. And what they're trying to do is restore that function between the neuromuscular skeletal system and the whole rest of the body. Because as we know, a lot of times if you have one area that's bothering you, the rest of the body kind of compensates for it. And so it can kind of mess up, your whole chi, messes up your whole flow of everything there. So, and it's meant to achieve and maintain health of the whole body. That's what they're looking at, is a whole body health, not just you go to a doctor because your back hurts. They're not just trying to help your back. They're trying to influence that area of your back so the whole rest of your body can function as well. Especially coming from orthopedics, people with back pain really have a problem with a lot of other problems as well. So this type of treatment is used for all different kinds of illnesses. We're looking at arthritis, headaches, stress injuries, pain in your back, your shoulders, your knees. So if this treatment is the decision of the provider after they do the evaluation management. So they're going to follow all 3 steps of the E&M process. They're going to do your HPI. They're going to do the exam. And then in their medical decision-making process, they say, you know what, this treatment really is going to help the rest of your body for this problem that you have. And they do that on a case by case, a visit by visit. That's not something typically like in the area I deal with all the time. We'll come back next time. If it's still bothering you, we'll give you an injection, right? And so this is kind of I really think this is going to help you today. Maybe next time you'll be better, but this is what we're looking at. So the codes we're specifically dealing with in CPT is just one small range of codes, 98925 to 98929. They're in the medicine section. So you're dealing with the different regions of the body. So you will only ever be billing one code per data service, and it depends on how many body regions you did. So you're not going to bill 98925 twice, or times 2, or times 3, or times 4. You're going to bill for however many body regions they did, and you're only ever going to bill that one code. And when you're looking at, you're wondering, okay, well, you got 10 body regions. Well, what are they? Well, those are described in our ICD-10 codes. So we're looking at a segmental or somatic dysfunction. So that's what they're looking for, somatic dysfunction. The head is one region, cervical, thoracic, lumbar, sacral, pelvic. Lower extremity, something affecting all of the lower extremity, all of the upper extremity. Your rib cage, or the abdomen and other regions. So those are up to your 10 areas that they're looking for, and that they're going to do. You have a somatic dysfunction, and then they're going to manipulate that area. So you would append the modifier 25 with an on the E&M. So you only put the 25 on an E&M, of course, if you're going to bill that in conjunction with one of these 98925 through 98929 codes. But your documentation, this is why it's so important. Remember, Alicia's talking about home health, had a lot of those things coming back from fraud and abuse. They're really looking at these codes too, because they need the documentation to prove that they did that evaluation and management and now they're doing something else. So it needs to say in the documentation, the region that was identified during the exam that has been diagnosed with some type of somatic dysfunction, whether it is skeletal, arthritic, myofascial, visceral, or related to some kind of lymphatic disorder, or it's going to affect some other kind of element in the lymphatic system if we don't, or neural system or vascular system, if we don't correct this. So, and it's possible to include a note specifically detailing those regions, but it also should say what techniques you used. And I give another website at the very end, so you'd have the information. 40 different types of treatments that they can do. So which techniques did you use? And then how did the patient tolerate the treatment? That is probably one of the most important regions or answers they're looking for, is how did the patient do after you did that treatment? So the American Osteopathic Association gave some tips that they say for documentation. Always separate the E&M services from the procedure note. That's their tip. You know, everybody, of course, does things their own way, especially when you have templates and things like that in EHR nowadays. But they suggest to separate them so that you can identify that E&M source and that manipulative treatment. Never bill more than one E&M service per day per physician. It's funny that they have to include that as a tip, but what if somebody in the practice saw you, but somebody else is best at that technique, so they want you to see them? Well, that other physician now can't bill an E&M as well. So I guess, you know, that's why you do one E&M. And you're not going to use modifier 59. Apparently that's what a lot of people are doing with some of these common errors, is it's a 25 on the E&M service. So the E&M gets a 25 and then you include your manipulative treatment code. So, and actually this came off of another website that I have. This was an article, actually, a journal paper that was written, and they said in CPT 2009 version, it gave this specific definition for a modifier 25, that the physician may need to indicate that on the day a procedure or service identified was performed, the patient's condition required a significant separately identifiable E&M above and beyond that other service, above and beyond. So the E&M was totally different from this one, or it's beyond that usual pre or post-operative care associated. So the E&M service may be prompted by a symptom or condition for which the procedure or service was provided. So this is part of the 25 definition for modifier 25 out of CPT 2009. And so they're saying this is what distinguishes you being able to do an E&M on that day, because you met all three components of the E&M. But based upon that evaluation, that provider found a condition or a symptom that warranted additional treatment. So you have to meet all the components of the E&M and then separately. And there's a link to that journal article. It was pretty interesting. I do that a lot for my studies right now, is a lot of journal articles. So it was fairly interesting, especially to find an article that I'm interested in. Now, payment. This is where people have a problem, and I do a lot in billing, so I like to incorporate the payment side along with coding. Many times payers do deny that as bundled, and a lot of times people aren't putting in the 25 with the E&M, so that's one reason that it's going to get denied. But if you have that 25 and the documentation can is exact, is what they're looking for, can specifically say that separate service, the areas, the regions, and the outcome, then that you can uphold and say, no, you cannot deny this. These are two separate things. Now, of course, insurances have their own guidelines. Maybe they only allow 2 a year, or maybe they only allow it for certain conditions, which is possible. And that's their choice as that insurance carrier. But remember, we're still going to report them because we do that for statistical reasons. So I did find a couple examples. There's Work Comp Ohio. They say that you can do the E&M and maybe billed on that same day. But then they're saying, you know, include on that first visit what that significant change was, what changed in their condition that prompted this. And also because they're saying, look, the E&M you did, you might have changed your medications, you might have done some x-rays or some lab imaging. That counts as your medical decision making. That counts as part of that whole E&M. And then you have the OMT. United Healthcare mimics Medicare, and they have treatment guidelines. Treatments are acute or chronic, not to exceed 1 to 2 a month. So they have a time frame that you can do those. And then only one service can be billed per day, based on the description of the procedure code, of course, because you're talking about those regions, anywhere from 1 up to 10. And then you can't, if you go beyond 6 months, it has to be because of some condition that the patient has, like ALS or post-CVA, some specific condition that's affecting that area of the body and causing those somatic dysfunctions. So they have a little bit more. You always look at the insurance guidelines as well, and make sure that you're doing everything properly for that insurance carrier as well. Again, there's the link for those different techniques that are used. They told 40 of them. It just kind of named them. You'd probably have to do some more research if you're interested in that, or if the doctor even said, we use this technique. Well, is that a technique that's associated with a manipulative treatment? And kind of what did that do? Did they just kind of thump them on the back and everything was good, or what exactly is entailed in that technique? So.
Awesome, thank you.
Do you need more medical certification and business training? Learn more at www.cco.us.